Today we're going to teach you how to do CPR on an infant. So typically an infant is defined as less than 1 year in age, but typically I like to use a better recommendation of an infant as anything you can hold and control with one hand, such as this. If it gets too large to control with one hand, I would suggest going to your child's CPR. With that being said, same process as before with adults. You always want to find that there's an emergency, check the scene to make sure it's safe and clear, to figure out maybe what happened to this infant. After that point, we want to check for responsiveness. With a baby, it's hard to tap the shoulders. They don't respond to that. You definitely don't want to hit them in their soft skulls. So what we say is we hit them on the bottom of their feet hard enough to try to make them cry. If they don't cry, we know that they're unresponsive. And from this point, we want to check for a pulse and breathing. Best place to check for a pulse in a baby is on the brachial pulse right here on the arm. This can be hard to feel because they have tiny hearts. So my preferred method is actually to listen for some breathing and then actually place my ear to their chest to hear for a heartbeat. If these things are not present, then we would want to start CPR and also make sure that we contact 911 by asking someone else to do so or pulling out your phone and putting on speaker as you start CPR. For this process, again, we want to find middle of the chest. Again, a good rule of thumb is the nipple line. We go in between those, we're on the diaphragm. And in this particular method, we can use fingers. You can use a full palm, but that's kind of big, but you can get away with fingers. You pick 2 fingers you want to. It can be any ones you want. Thumb and pinky's kind of weird, so typically most people go with their center 2 or their index and their middle. And then we're going to put them on the center of the chest and push down, trying to go at least 1.5 inches. And we're going to keep that same rate of 100 beats per minute. So Another One Bites the Dust is a good song to sing to keep that rate up. You're going to continue this process until an AED arrives and you put that on, or further medical help arrives as well.